Okay, let's kick this off. My name is Brad Ball. I'm the Director of Marketing at Client Track, and I want to welcome everybody for joining us today for this webinar. As part of our initiative for 2013, we're kicking off a series of webinars, of which this is the first one. And we will be recording this, and we'll make it available afterwards. And I'm pleased to introduce Kim Atkins. Kim is a professional. He's been involved in human services for over 20 years, and most recently he served as CFO at the New York AIDS Service Center. And I've had the opportunity to meet Kim a few times, and I've been very impressed with his knowledge and deep understanding of human services, and particularly in the AIDS arena, but also just his breadth of knowledge across the entire human services sector. So without further ado, I'm going to let Kim go ahead and take over. And what we'll do here is we'll go about 45 minutes and then open it up to questions. If you have a question, rather than interrupt, go ahead and submit it through the chat that's facilitated through the GoToWebinar, and we will moderate the questions and ask them after, and then probably the last 5 or 10 minutes we will open it up for everyone. And so feel free to go ahead and ask a question through the chat. And once again, I'll introduce Kim and have him take it away.
Thank you, Brad. Welcome to our webinar today, everyone. In the audience, we have nonprofit staff ranging from data managers to CEOs, and small and large agencies that address housing, AIDS, homelessness, domestic violence, located all over the country: New York, Texas, Idaho, Ohio, Florida. So I believe there's something for everyone in today's presentation, but I hope in the future there'll be more presentations targeted to specific areas and concerns, and you can certainly give us your feedback on that. So improving quality care through data management. What do I mean by improving quality care? I assume that you all are committed to providing quality services, whatever your mission and types of services are. I also assume that while you may already provide quality services, there is always room for improvement and for adapting to changes in the environment. And I assume that we all do what we do for our clients, and that ultimately it is our goal to improve what we do for our clients so that their lives might improve. So even in areas where standards of care are not clear and the measurement of quality against those standards is difficult, there is value in improving upon the quality of care we provide. And meaningful data is critical in attaining this improvement, including the measurement of improvement in clients' lives. Through this, data management can support and affirm the mission of each agency. Do you manage your data, or does your data manage you? Here are a few questions that we want to start with. Does your data make sense to you and what your agency does? Does your data help you to manage your programs, operations, and finances? Even if you answer yes to this, there is value in the rest of what we'll discuss today, but for many of you, I think the answer may be no, or only a partial yes. And that is because your answer to the next 3 questions is probably yes. Do you spend your time gathering and sending data to others? Do you have little time to analyze what your data tells you about your agency, services, and clients? Do you manage independent data sets that are difficult to relate to each other? In a nonprofit environment, it is critical that we give those funding our programs and services the data that they ask for, or we'll lose our funding. These funded programs are isolated for the funder, part of the same program funded at different agencies, although for you, they are part of a larger service array. Since funders often do not fund or support data management directly, or if they do support it, it is often at a very reduced level of cost, there are few resources to support data management beyond that which is directly related to the funded programs and services. Nonprofits are always struggling to obtain support for general operations, including data administration. This is not to say that it is possible to go from one extreme to the other and ignore data demands from funders in order to focus on what you need to know about your business. Rather, it is important to find the right balance. Data is critical for nonprofits in meeting funding requirements. More and more funders are requiring more than data on their program. They want you to use their reporting systems. They often want data on clients at the start and at the end of a program, showing the impact of the program on improving a client's life, requiring you to establish some measure for success. And some are even setting some level of standard for program performance that may change from year to year. Data is critical for advocating for new, continued, or increased funding. We all use data for grant applications for new or continued funding, both program data that reflects the ability of the agency to impact clients' lives positively, as well as data related to the need for services in the specific area and of the specific type you are proposing. Data is important for evidence-based decision-making. When the numbers don't agree with your gut, you're going to learn to follow the data. This means evidence-based for you and your operations. I will discuss further this area as it is critical for an agency to develop its own key data reflecting its unique set of services and style of service delivery. The problem is that without this data, too many decisions are made from the gut and not based on what's in front of you, because that data is not available. No matter how much experience many nonprofit managers have, there is a time when the data does not back up the gut, and that is precisely the time when you need to be ready to make changes. Data is critical for improving service delivery. When the client's happy, more clients find their way to you. Focus groups are critical to keeping services relevant. As long as clients are satisfied, they really talk to other people and bring those people to you. We all rely on word of mouth for the best referrals. And data is critical for improving client outcomes. Ultimately, we're in the business of improving clients' lives, and we need to prove it to ourselves as well as to our funders. Can we objectively demonstrate that a client benefited in some way by getting services? While funders now require baseline and follow-up client data that remains with a program generally, with so many clients getting multiple services over a period of time, can you show the impact of a client's enrolling for services and staying with the agency over that period of time? Not just for the funders, but to your board and to yourselves. Are you making the difference that you hope to or think that you are? Valuing data. Placing a high value on data is critical to the integrity of the data. Funders value data, so much so that they require we use their data systems to report to them. Why are more funders delivering a data system to you to use for reporting their program data? For one thing, this makes it easier for them to collate their data across many different funded programs and provide for analysis and summary reports on their end. But it is also part of a movement to require program-funded staff to perform the data entry themselves. Those performing the service are more likely to understand how to properly code something in the way the funder wants the program services delivered than an independent data person. And if there are consequences for incorrect data, the program person has greater incentive to get it right to begin with. Funders value data to monitor that you're doing what you said you would in receiving their funds, obviously. Basic level, they still want to know that you are doing what you said you would do with their money. They also want to document that this is improving the lives of those served with their funds. Since it is difficult for many agencies to agree on the baseline and follow-up data that show client improvement, funders are now trying to define some basic parameters for documenting that their funding is making a difference. After all, government agencies must report to legislators, and foundations and corporations must report to boards on the impact of their investment. Increasingly, the impact is focusing on client outcomes, not how many things were done for someone, but did it do any good and how long was it sustained? Do you value data? Does your management value data beyond sending the funders what they want to keep giving you money? Do you manage to the expectations of the funder, or do you have your own criteria and expectations of staff in delivering services? After all, even within a program, there are many things that must be done that are not required to be reported to the funder. Do you value data to monitor your staff are doing the work? Do you use reports to assess your staff in meeting their work deliverables? Do you use the same report sent to the funder or something else? Is it a report that helps you make corrections before you find out that the staff did not meet the program expectations? I'd like to give an example here from a program that was implemented at a service center, a changeover from a grant-funded program to a performance-based contract really illustrates some of these points. The funder moved from paying a regular monthly amount based on the program budget to paying based on the number of services provided in 6 different service categories. In the grant-funded situation, the program data requirement was that an agency maintain 90% of service target levels to get full payment. And if it was off in 1 month with a valid explanation, there was no concern. Only repeated failure to meet 90% of all targets would result in any loss of money, and that really took a lot. In the performance-based situation, the agency was only paid for what it did in any month, and the services paid for were delimited to a fixed number of service types, although other services would be performed in the course of delivering those paid services. If program performance was under 100%, then an agency received less than the full amount of funding. And there was some provision for enhanced funding for reasonable overages if, if services went beyond the budgeted amount. There were several consequences here. First, the service data for payment had to be prioritized over the data for non-reimbursable services, requiring the creation of a new data form. Second, it was necessary to implement a system of weekly submission of forms to the program manager to ensure that program services were being delivered at a rate that would ensure appropriate billing or reimbursement for a month. There was no time to make up for service deficits if we had waited until the monthly data submission to the funder. Finally, the year-to-date data had to be assessed continually to ensure that we would meet 100% of the targets to obtain 100% of the funding, and also have an opportunity to get any possible enhancement to that funding. Thus, we tried to meet all targets before the end of the year and would go above target to possibly get more. We changed our total internal data management to make this happen. So do you value data to assess the quality of your service to clients? Are you regularly assessing the quality of service delivered to clients? Are you getting feedback from staff and clients about issues and problems? Is there a plan to correct or improve on them? And do you value data to measure the effectiveness of your service in clients' lives? Do you regularly assess the impact of your agency services on those lives? Do you have clear factors that demonstrate the improvement in clients' situations over time? And do you regularly look at how you're doing? Improved health, by what measure? Stable housing. Reduced substance use? Many factors impact ultimate outcomes, and what do you really control? Does your staff value data to monitor that they are meeting their expectations? Do your staff want to know and show that they're doing what they're supposed to? Or do they hide behind data being late or not available to say that they would have met the target if only they had known? Do your staff value data to check that these are the services the clients need? Are your staff just doing the work, Or are they aware that clients need some things and not others? Are they willing to give you feedback on what changes are happening out there? Do your staff value data to see that the work they do actually makes an impact? Do they care about the work they do with clients? Would it improve their work if they understood just how they were making a difference? If you do not look at data and discuss what the data means to you with your staff, then your staff will not be concerned with the data and what it means. If the data the staff are asked to report does not reflect the work they are really doing with clients, if it is just to tell the funders what they want, but what really matters is something else, then staff will not be concerned with the data collected. If staff don't value data, then the quality and accuracy of the data that is collected will be suspect. Funders focus on data for monitoring and evaluation. Funders monitor that the funds are being used for activities as defined by their program. As a manager, you also want to ensure you're meeting the program deliverables regardless of other needs. Funders want to evaluate the impact the funded activities are having on clients as defined by their priorities. As a manager, you'll want to make sure you're measuring the success of your services in terms of the funder's outcome measures, even though your agency measures may be differently defined. Because of onerous data requirements of funders, many agencies use only this data to assess their business. There aren't resources to do more. The priority for nonprofits is to give the funders the data they ask for. Successful organizations have multiple funders, thus multiple data requests. As funders become more data and outcome focused, the data requirements for each funder are expanding, and more funders have developed systems, many web-based, that are required to be used by those programs, and you have to report to them not just what they want, but how they want. Although new funder systems are capable of making data available back to agencies, this feature is often the last developed, as funders find system development is more costly than originally budgeted. So don't count on these promises being met. Too many times, funders have said their system will give you the data, you won't have to duplicate data entry anywhere, but when push comes to shove, that is the last thing that gets developed, so don't count on it. Data for funders is often handled as a separate task from managing services. Since the funder's data is often not how managers and staff refer to the services they provide, this data is handled as a separate program administrative task. Reports to funders are due a month or more after the activity has occurred. This is useless for managers who need data for daily operations. Managers are forced to create their own data systems to manage programs and operations. The further away staff are from understanding the required funder data, the less accurate that data may be, and many times it is left to grant staff to translate for funders. If the agency data elements are less valued than the funder data elements, then the agency data will be less useful. Staff won't care, since what is reported to funders is different. Sometimes you will have staff working for the program, not for the agency. Unfortunately, data required by funders for their specific program most often does not align with information needed by management to make internal program and service delivery decisions. The data itself is limited to a program and does not relate client activities across programs. Even data elements of client demographics can vary, as some funders want more detail than others, or slightly different variables. Do you ask more data from every program just to get the information for one or two programs. Often agency program success is due to synergy between agency programs, which management needs to analyze. Clients engaged in more than one service often do better across the board. Each agency has unique ways of doing things and unique combinations of services that create its identity. These need to be reported and assessed in the agency terms. Many agencies translate funder-defined categories into their own terms, their own data elements, and having two sets sometimes confuses staff. Recognizing these limitations of funding-driven data management, some funders are now requiring agencies to participate in quality improvement activities. In New York, for example, the state and city health departments have set up quality learning networks for all providers funded to deliver a particular type of program. Quality improvement is aimed at improvement, measuring where you are and figuring out ways to make things better. It specifically attempts to avoid attributing blame and to create systems to prevent problems from happening. There are three types of measures used in quality work. Structure, which looks at facilities, physical layouts. Process, how the system of delivering services works. And outcome, the final product, the results of the work. Structure and process are easier to measure, but outcome is more important. So outcomes need to be defined in measurable terms, and that's hard work. Improved health is hard to measure in a general way, but with regard to HIV, reduced viral load is possible to measure. Improved stability is hard to measure, but a homeless person placed in stable housing and living there for a certain number of years is possible to measure. Carefully define outcomes so that sensible data can be collected and used to measure appropriate progress towards these desired outcomes. Quality improvement is data-driven and is focused on improving quality care within an agency against standards established in a service industry. There are several quality improvement methodologies, all focused on identifying problem areas, gathering prioritized data, and analyzing it to make needed change. Quality improvement moves the focus from the program to the agency, as all factors impacting program performance must be looked at. How is the program implemented in the context of the agency? Just to refer to some of the methodologies, and everybody may have heard some of these. Six Sigma is a quality improvement methodology used by many large agencies and corporations and business, not just nonprofits. There's PDSA, Plan, Do, Study, Act, used by many community health centers and other nonprofits. CQI, you may have heard of, Continuous Quality Improvement. TQM, Total Quality Management. If you don't know about some of these or would like information, you can certainly send me an email, and my email's at the end of the presentation. Some government agencies are now using quality improvement methodologies to drive system changes through agency collaboration. This is actually new, and it does require more data from agencies beyond the funding requirements, but it's interesting, and I'd like to give an example of something going on in New York. The AIDS Institute has designed a quality improvement project that asks all agencies, both medical and non-medical, serving clients with HIV in a geographic region, for example, the Upper Manhattan area, to report data on key factors to ensure that all those testing positive for HIV get connected to HIV care in a timely way, and that they stay connected in care. The purpose of the project is to build and improve on the collaborations between different types of providers in order to reduce the number of clients who get lost between testing programs and care programs, and the number of clients who drop out of care. The methodology is to get everyone to assume responsibility for improving on the region's data. So this is beyond the agency. This is taking ownership of doing a service in a geographic area. And the data, while close to what should be collected by each agency, is still defined a little differently than agencies would define it, and the reporting periods are a little different. So this becomes a different project. Doesn't completely dovetail with what you do, so again, it has great value, but at the same time, it's more work. Quality improvement does bring a culture of valuing data to an agency, although it, as I said, does often add on to data requirements. Quality improvement methods change agency infrastructure for identifying and acting on program, operational, and financial areas of concern. Data replaces experienced opinion as the basis for decision-making. Data is required to be accurate and relevant. Often data beyond what is already available is required to assess and address concerns. Quality improvement is itself the process to shift from funding-driven data management to agency-driven data management. Agencies need data to manage their business and their services to clients that accounts for funded programs, but which also incorporates the unique way an agency combines funding from many areas to provide services. And ultimately, it is outcome data for clients that shows the success of the agency approach. To manage this, the data must be available in real time, not a month later when reported to funders, and must look at overall operations between services, not just within programs. This data must be relevant to how the staff perform their work so that they can use it in providing services. Using it will ensure that it is both accurate and timely. The data must be consistent over time so as to reflect a historical record of a client's activity that can be assessed for individual change and improvement, and that demonstrates positive outcomes. So how do we get to that? Well, here are 5 steps to put you in control of managing your data. First, you want to identify what you need to know to run your operations. Remember, you're the experts at what you do. Define what data show that clients are improving as a result of your services. You know what's realistic and what is not. As I mentioned before, you need to be careful to define measurable outcomes. Then identify what data you're already collecting for funders that meets these needs and what data elements you're going to have to add. Prioritize the data. While all of the funder requirements you obviously have to report to them, maybe some of the other data can wait to be added later. It depends how critical it is. And once you've done this and you have data elements and what you need to measure and look at, identify a system to help you manage your data to meet your needs. It used to be tempting to build your own data system, but today there are many more flexible systems. And for me, it's been a huge jump in the last 5 years to systems that can do both of these things. They can report what you need for funders, but at the same time they can be structured to mirror what the agency is and what the agency needs. That wasn't true before, and so it was always tempting to look to build your own. So given that there are data management systems out there for you, here are 7 factors to consider in selecting the data system that should work for you. First, you want to make sure that it is scalable, that it will add or subtract programs, that it will grow as you grow, and when you lose funding or a program ends, that you're able to retain the history but move on to the next thing. You want to make sure that your data system is client-focused, that funder data systems are program-focused, and data is captive to each program. But agencies manage clients who get services in different programs as well as outside the agency. Third, you need to be able to, the system has to be able to manage sharing of data within compliance standards, depending on your business, obviously. Since the data will be used in your business, not just reported to funders, HIPAA and other privacy regulations, if you're in mental health, if you're in substance abuse, other areas, require that rules be in place to protect who sees what. And make sure the data system is flexible. Today's data systems are largely flexible, unless it's something built on, 20 years ago. But the newer systems are very flexible. You'll want to be able to add data elements as the business changes without losing the data elements you've already collected for clients, so without losing client history. Fifth, you're going to want to make sure that the data system is able to report on all the data collected. You are collecting data because it is valuable to know, so you need to be able to have access to it. Too many systems, and as I say, as quickly as possible, if staff can use data in delivering services, then the data will be high quality. For those of you who have experience with systems, too many of them have a lot of data, but it's not easy to access that data in simple reports. But today's systems make that a lot easier. Make sure that the data system is able to analyze and report data. If you have the data, you should be able to analyze it, so that today's systems have very easy features to relate data from one data set to another. Obviously, you want staff, managers, evaluators who are able to know how to analyze that data, but the system should be able to handle that without a lot of moving it into another system. And finally, you want to make sure the data system is able to interface with other systems. Something that's happening in healthcare these days is the term interoperability. All systems are being forced to be able to talk to each other. But to the degree you can download data to or from a funder's required reporting system, you can minimize any duplicate data entry. Soon all systems will have some of that interoperability, but there are some limitations now. Obviously, if you're forced to use an old system, as many of us in New York State have had to use a system based on FoxPro, and it's not easy to translate information from one system to another, you may find that you do some duplicate data entry because it's actually easier for the short run. But in the long run, everything should be able to be moved from one system to another. So I've marched through this and just want to summarize here that you need to get a hold of managing your data. Make improving quality care and service to your clients your priority for data management, not reporting to funders. Obviously, you need to meet funder requirements, but if you make improving quality care the priority, It will define the motivation for collecting accurate and relevant data for staff and management, and it reinforces a culture of evidence-based decision-making. Monitoring data remains a tool to ensure that programs are being delivered, but evaluation data is what's critical for management as well as for current and future funders. As your agency focuses on improving services to clients, clients will experience improved outcomes, and clients, you and the funders, will all benefit. Just a note on some further information on data management systems for you. Even if your agency does not require a bid process, and I think probably everybody does at this point, but it still makes sense to look at several systems, at least 3, to ensure that you're getting a picture of what is possible in a system and what is best for you. I recommend ClientTrack be one of your systems. They sponsored this today, but for those of you who are in the not-for-profit business, that somebody who worked in a not-for-profit kind of designed the look of it and feel of it. It's centered on the client and designed by a nonprofit service provider. ClientTrack is one of a few systems available now that can easily meet your nonprofit data management needs. And there's contact information for you if you're interested, if you don't already know about it. And if you have any questions or comments for me, obviously you can put them into the chat room for now, but you can also contact me later through my email address. And I want to thank you, and I'm sorry I pushed through. You may want some examples of other things I'm happy to give.
Okay, Kim, thank you very much for your presentation here. We do have a handful of questions, and we've got a poll here, and that everybody can participate in. One question we had, Kim, was relating to change management. And obviously, if you're making some changes, whether it be a system or whatnot, buy-in and is obviously rather important. And can you speak to change management and maybe real quick some useful points there?
Yes, absolutely. It's very important that you take an opportunity in when you are bringing on your own system to review your processes, because too often automation just automates what's already in place very simply and expects that will make an improvement. But systems are built to do things differently, whether it's through automatic email or through sharing information with people immediately that were not able to share it before, and you had to have paper processes that become very cumbersome. So it's very important to, number one, work with and ask the question of your provider in looking at a data system, what they can do for you and helping you understand how the features of that system can help you change how you do your business to make it better, how you can improve what you do through the capabilities of the system. And that requires somebody in the agency to know enough about the system and about the program to know how you can make some of those changes. And I say it's better to do that at the very beginning of the process than find yourself later on making all sorts of changes after you've implemented a system and already set some things in place.
Okay, Kim. Another question revolves around using a consultant. If you're a nonprofit or even a small government agency, can you speak to the importance of using a consultant? Is it necessary? Is it not? And have you have experience doing this before?
You can use a consultant if it's somebody who understands programs. It's very difficult in agencies that have few staff to take one of those staff and move them out of service delivery. But and I know this from both grant writing and working on systems, that if you bring in a consultant, you're still going to have somebody on your staff who is going to work with that consultant so that they really understand what you do. Because if they don't understand what you do, then they're still not going to add the value that you need to easily make the improvement. As many philosophers say, the beginning is half of the end. If you do it right to start with, then you're on the right path. If you have to fix it later, you're going to spend a lot of money and a lot of time rejiggering things.
Getting a couple questions relating to cost, and obviously this is dependent upon your organization. And do you have any guidelines, Kim, or rules of thumb, or any information regarding cost of a system? What organizations should be looking for? And can you speak to that for a minute?
Yeah, I mean, I'll speak to it without giving numbers, because I think that people need to understand there are three major components to implementing a new system. One is obviously the setup of a new system. We'll call that the implementation cost. Then there's the ongoing cost for using the system. And there is what I'll call the data conversion cost. And in each one of those areas, you need to make some basic decisions. What is important in data conversion is that you assess whether you really have good data to convert, or how much of the data you have is really good data and is useful. Because in many cases, they have a lot of data, but it really isn't what they need. So you don't want to waste a lot of your resources moving data from one system to another that's not going to be used later on. The second thing is, in general operations, I think what people may not realize that today's systems, some of the modern systems, work a lot easily. They work more easily for not-for-profits, in that you really only have to pay for what you use, the number of staff using a system. Again, talk to the salespeople about how these things get structured. But if you only have 10 or 15 people using a system, you're able to do that, and the pricing is structured so that you're not having to pay for upgrades and all of that in the way of the old software business. It's entirely different, and you need to educate yourself on how that is going to work for you very easily. The last thing is the implementation cost, and like I said, this is where you're going to be tempted to try to reduce costs, but I think this is where you have to say, if I can get some extra resources to get it right to start with, then it's going to work better for me, and I won't be spending money later on. So, you may be tempted to keep your implementation costs down, but I would say that's the last area that you should cut. You should really look to trying to get what you need so that the system works for you right off the bat. Because if you do that and you get it right so that your staff can use it immediately, and that it makes sense to them, and they're getting reports back, all of a sudden you don't have a long implementation phase. You've got people wanting to use it and wanting to get data right away. So the implementation is the first cost is very important.
Okay. Got one or two more questions here, and it looks like we're getting a couple people saying the audio is getting a little bit faint, and so
okay, well, that may be because I'm dropping the microphone.
Oh, okay. Sounds good. Kim, another question is trends that you might see over the next year or two. Not necessarily specific, realizing that you come from a background involved with human services and AIDS in particular, but what do you see as far as upcoming trends in human services as it relates to improving your data management?
Well, customer-focused perspective, but the changes that are going on in healthcare are affecting agencies who do other things because it's recognized that stability of clients is important in improving health for those clients. Homeless clients, housing for homeless clients is critical, and improving health is related to getting housing for clients. So even though it's not a healthcare, even if it's not a healthcare service that you provide, you may be caught up in some of the healthcare changes. And that's where there are changes in data systems, and I talked about interoperability, but people are going to have to share data with other agencies more directly. Did a client get this service? What was the result of that service? This is where everybody has to learn about what they can and cannot share with each other, and the systems are able to do it, are able to share it. The question is, can they have the rules for confidentiality built in so that they only share what they're allowed to share? And we can maybe do a webinar about health homes and the implications on data systems in the future.
Okay. All right. Well, just wrapping up here, we're going to open it up if anybody has a question they'd like to ask. And as we're wrapping this up here, we've recorded this session, and it will be available. We'll publish it, and so if you're interested in it, certainly you can be in touch with us. We'll post this here in the next few days. Also, I do want to mention that in the future, if anybody has a webinar suggestion or perhaps would like to participate, feel free to contact me directly. And like I say, this is the beginning of a series, and so certainly if you have suggestions or information, feel free to contact us. So really, we'll open it up here. If anybody has a question, you can raise your hand. You can submit through chat. I think we've exhausted a few questions here, and it's been a productive webinar. But it looks like we're going to wrap up here. Okay. Well, Kim, I want to thank you once again, and we'll go ahead and wrap this up. And Kim, do you have any final thoughts? Any words?
All I want to say is that it's very important for all of us as not-for-profits to take control of our data and to use it to make our jobs better and not be victims or just responding to funders, but to really take charge of it. And there are now systems out there that will allow us to do that, and they are cost affordable. So if anybody wants some assistance with where to start looking, some other details about what's important and what you can manage, be happy to answer those things. But I think now's the time to get on top of this before we're too far behind.
Very good. Once again, thank you, everybody. And any questions beyond this point, feel free to, Kim left his contact information, or you can contact us at Client Track, and we'll be happy to facilitate. So thank you very much, and appreciate everyone attending.
Thank you, everyone.